Hi, I'm Dr. Sharbell Hashoul, and today let's talk about what to expect at your very first mammogram. If you've got one coming up and you're feeling a little nervous, that's completely normal, and by the end of this video, you'll know exactly what's going to happen step by step. First, let's talk about what a mammogram actually is. It's simply an X-ray picture of the breast. Think of it like a specialized camera that lets doctors see inside breast tissue, looking for anything that might need a closer look, often years before it could ever be felt as a lump. Most guidelines recommend starting regular screening mammograms sometime between ages 40 and 50, though your own doctor will help you decide the right starting point based on your personal and family history. So, what happens on the day itself? When you arrive, you'll check in and change into a gown, usually from the waist up. You'll be brought into a room with the mammogram machine, and a technologist, almost always specially trained in this exact procedure, will guide you through everything. There's no need to prepare anything complicated beforehand. A couple of small tips though. Try not to wear deodorant, powder, or lotion on your chest or underarms that day, since these can sometimes show up on the images and cause confusion, and it can help to wear a two-piece outfit so you only need to undress from the waist up. During the actual test, the technologist will position your breast between two flat plates on the machine. These plates will gently compress or flatten the breast for a few seconds. I know the word compression sounds uncomfortable, and honestly, some women feel pressure or mild discomfort during this part, but it's brief, usually just several seconds per image, and it's absolutely necessary. Flattening the tissue spreads it out so the X-ray can capture a clear, detailed picture with the lowest possible radiation dose. Thinner tissue means a clearer view and less radiation needed to see through it. If you find it painful rather than just uncomfortable, tell the technologist. They can often adjust things, and sometimes timing your mammogram about a week after your period, when breasts tend to be less tender, can make a real difference. The whole appointment, including checking in and changing, typically takes about 20 to 30 minutes, but the actual imaging itself, the part where compression happens, adds up to just a few minutes total. Usually two images are taken of each breast from different angles so the whole picture can be seen clearly. Now let's talk about what happens afterward. Depending on where you're being screened, you might get results the same day, or it might take a week or two. Here's something really important to know up front. It's quite common to be called back for additional pictures after a first mammogram. This does not automatically mean something is wrong. First-time mammograms don't have any prior images to compare against, so doctors sometimes want extra views simply to get a clearer baseline understanding of your unique breast tissue. Most callbacks lead to a simple explanation and no further concern. Try to keep this in mind if it happens to you, so a callback doesn't feel like a red alert when it's often just part of getting a complete picture. One thing many first-timers don't expect is learning about their breast density. Your report may mention whether your breasts are dense or not. Dense breast tissue is very common and simply means there's more glandular and connective tissue relative to fatty tissue. It's not a diagnosis, but it is useful information, since dense tissue can sometimes make mammograms a bit harder to read, and your doctor may talk with you about whether additional imaging makes sense for you personally. Here's my one practical takeaway for today. Before your appointment, jot down any breast symptoms you've noticed, any personal or family history of breast cancer, and the date of your last mammogram if you've had one elsewhere. Bringing this information helps the radiologist interpret your images with real context, and it makes the whole visit smoother. Mammograms are one of the most well-studied tools we have for catching changes early, and walking in informed can make the experience feel far less intimidating. As always, talk with your own doctor about when to start screening and what your particular results mean for you. Thanks for watching, and I'll see you next time.